Vasculitis means inflammation of the blood vessels, the tubes that carry blood around your body. There are three types of blood vessels which can be affected by vasculitis. Arteries that takes blood from the heart to different parts of the body, such as organs, for example kidneys, and tissues, for example skin. Veins that take the blood back to the heart, and the capillaries, which are the tiny vessels between the arteries and the veins, where oxygen and other materials pass from the blood into the tissues. Inflammation causes swelling of the blood vessel wall, reducing or even blocking the flow of the blood to the tissues and organs. Vasculitis can cause a range of symptoms and possible complications. The amount of damage vasculitis can cause depends on which part of the body is affected. The larger the affected blood vessel, the more damage there may be. The more important the affected body tissue, the more serious the damage will be. Apart from the damage to the blood vessel itself, this can lead to damage in the tissues or organs which are supplied by the blood vessel. Vasculitis is uncommon, however, it can occur suddenly in someone who has previously been completely well. When it occurs on its own, doctors call this primary vasculitis. Vasculitis can also occur alongside other conditions including rheumatoid arthritis or lupus or Sjogren's syndrome, in which case it's known as secondary vasculitis. The different types of vasculitis tends to affect different age groups. For example, GCA or giant cell arteritis is also known as temporal arteritis, is much more common in people over 50 years of age, and it's fairly common for it to be associated with a condition called polymyalgia rheumatica or PMR. Takayasu arteritis tends to affect younger Asian women. IgA vasculitis is much more common in children than in adults, and Kawasaki disease only affects children under 5 years of age. A small vessel vasculitis, which has a specific blood test called ANCA or anti-nuclear cytoplasmic antibodies, also called ANCA, seen in their bloods, can affect both adolescents as well as adult patients. Symptoms. Many people with vasculitis feel unwell and have fever, sweats, fatigue, and weight loss. These can be the first symptoms experienced, so it's important to be seen by your GP. Other symptoms vary according to which part of the body is affected. For example, in the skin, vasculitis in the skin can cause spots and rashes that can burst, leaving open sores or ulcers. When vasculitis only affects the skin, long-term effects aren't usually serious and symptoms normally clear up once inflammation has settled. In nose, vasculitis can cause crusting inside the nose and nosebleeds. Sometimes the shape of the nose can change as well. Fingers and toes. Some people with vasculitis experience Raynaud's phenomenon, where the fingers or toes turn white or blue and may tingle or hurt when exposed to cold conditions. Eyes. Some types of vasculitis can suddenly affect your vision or causes your eyes to become red or painful. It is very important to see a doctor quickly if that happens. In nerves, inflammation of the nerves can cause tingling, pins and needles, pains and burning sensations, or weakness in the arms and legs. Among joints, vasculitis can cause joint pains or swelling. Among muscles, inflammation here causes muscle aches, and eventually your muscles could become weak. In lungs, inflammation of the lungs causes coughing, shortness of breath, and in brain, occasionally the blood vessels in the brain can be affected, causing problems like strokes. Kidneys. When vasculitis affects the kidneys, there may be a problem passing urine or blood in the urine is seen. Vasculitis of the kidneys can be dangerous, as symptoms may not appear until the kidneys have been damaged. In severe cases, treatments on an artificial kidney machine called dialysis may be necessary. Headaches, pain in the jaw, and problems with the eyes can be serious symptoms of giant cell arteritis, and you must see your doctor. These are treated with steroids or immunosuppressant medications in order to prevent damage to the organs. The treatment may be long-term or may be lifelong in some cases. Your doctor or specialist will guide you in this. It is diagnosed and treated by your rheumatology team, and you will require blood and urine tests and may need other tests including x-rays, scans, and even biopsy, which is a sample of tissues taken for analysis.